A lot of people are taking GLP-1 medications without really understanding what these drugs are doing or not doing. They're often described in very simplistic ways, like they make you less hungry, you don't think about food so much, you don't feel much like eating. But that's not the whole story. These medications affect appetite, digestion, food thoughts, and the way your body responds to eating. And it helps to understand that before you decide whether they're right for you. I'm Dr. Vivian Lowe, board certified in internal medicine and obesity medicine with over 20 years experience in treating people with obesity. I'm the author of a book on the GLP-1 system, and I break down the science, the real-life challenges, and the practical questions people have about GLP-1 medications. Let's go. Okay, so in this video, we're going to be focusing on the medications, the GLP-1 medications. In the previous video, I talked about how your body makes GLP-1 from this big molecule called proglucagon, and that you make it together with other hormones, right? In the case of GLP-1, you're going to make it together with GLP-2, glycine, and oxyntomodulin. The GLP-1 medications are different. All you're getting is the synthetic GLP-1. It doesn't come along with the other hormones. And so it's just that one hormone and that one signal. So already you see the difference because it's not acting in a system. It's pretty much there on its own, okay? And it's a very powerful signal. The reason for this is, if you remember from the previous video, I talked about how when you make your own GLP-1 in the gut, there's an enzyme that's called DPP4 that breaks it down very quickly. So in a matter of minutes, you really will have broken down most of the GLP-1 that you've made, all right? And not very much is even going to get into your bloodstream. So if you hear people tell you, oh, you can eat a certain way and then you make your own GLP-1. Well, anytime you eat a mixed meal, you're going to make your own GLP-1. The problem is that it gets broken down so quickly and not much gets into the bloodstream. So the effect is just for a small period of time. Right? So if people are telling you if you buy this supplement, you can make more of your own GLP-1, and the problem isn't that you can't make your own GLP-1. The problem is that it breaks down so quickly, so it doesn't have a sustained effect in your body. With the medications, it's different. They've modified the GLP-1 in such a way that it stays in your system much longer. So, instead of minutes, it's going to last, 5 to 7 days. So very, very much longer. So because again, it's staying in your system for so long, you have now high levels of this GLP-1 signal in your bloodstream. The medication levels are 7 to 40 times the highest levels that your body makes. So this is way, way more than your body will ever make, regardless of what you eat or what supplements you take. All right. Now, this means that we go from a balanced signal. So remember, the GLP-1 system that you make functions together in a system with other members of the proglucagon family, right? And it's more like listening to an orchestra. That's a balanced sound. When we use the GLP-1 medications, it's like putting the mic on the tuba guy, all right? And now they're playing the same music, but all you hear is the tuba. So it distorts the music. And we go from a balanced signal to an override signal, right? Pretty much the GLP-1 signal now is kind of shouting, all right? And that is a big difference because it's not functioning in synchrony, right, with the other hormones. Remember, I said that your GLP-1 in your body is going to rise after you eat. And then it doesn't stick around very often, and it's degraded and it pretty much drops to almost nothing. So in your body, you have cycles following your meals, and also different times of the day, you might have higher levels, depending on the circadian rhythm. With the GLP-1 medications, that's not the case. Again, they're modified to stay in your system much longer. So it's on 24/7, and the half-life is 5 to 7 days, as opposed to 2.5 to 3 minutes with your body's system. Now, of course, the main effect that a lot of people are looking for is weight loss. And once you have weight loss, you have the benefits of weight loss to your health. So for many people, they'll find that their blood sugar is better controlled. If you have something like fatty liver, an accumulation of fat in your liver, well, when you lose weight, you can reverse that. And that fat will go away and your liver will be a lot healthier. When you're at a higher weight, you're at higher risk for cardiovascular disease. And when you lose that weight, those risks drop. Also, if you have something like sleep apnea, then you'll find that that might actually get better, or you might even, not have any more significant apneic episodes anymore when you lose the weight. And some people just, even if they don't have sleep apnea, they find themselves sleeping a lot better. So these are all wonderful effects from weight loss. Now, the weight loss can come from GLP-1, it could be from surgery or just from lifestyle modification, right? The GLP-1s are very powerful weight loss medications. And so we tend to think of the benefits in terms of how much health benefit you can get with the weight loss from these medications. But there are other effects. So the most common effects are usually GI. They're affecting your digestive tract. I'm sure you've heard of it. Many people complain about nausea, vomiting. They may have heartburn, and they're not able to tolerate large volumes of food. So they find themselves picking, and many people will report that they are not hungry anymore, and sometimes they even forget to eat. Now, besides making you not so interested in food, the other thing is that your thirst drive on these medications, your thirst drive actually drops. And so people become at risk for dehydration, especially if they have nausea and vomiting along with the other side effects. So if you're dehydrated, you have a little bit of vomiting, and you're not drinking as much, you're going to have an increased risk for constipation, and you might be very uncomfortable, feel very bloated, and that's another side effect that people complain of when they're on these medications. So, while you're on these drugs, you're going to have some of these effects. For many people, the effects of the negative side effects do go away or get better with time. And for some people, it stays the same and doesn't really get better. But very important is you have to make those lifestyle modifications. Otherwise, you're going to continue to struggle while you're on these medications. Okay, so we've seen now the difference between your body's system and what the drugs actually do. The body system is actually a pulsatile rhythmic system, and the levels of your GLP-1 are going to shift with meals and when you're not eating, when you're fasting. Also, they work in conjunction in a balanced way with other hormones in your body. Whereas the medications cause a very loud signal and they persist for long periods of time in your body. And as a result, you get quite profound weight loss. So in the next video, I'm going to talk about the results that people always mention when they think about these medications, the weight loss results and so forth, and compare that to real world results that people have when they take those medications. Okay? And in the meanwhile, some of you may already be on these medications, or you're thinking of starting, or maybe you're even trying to get off these medications. And I've designed a GLP-1 guide and workbook to help you navigate your GLP-1 journey. It includes live Q&A sessions with me in case you have questions from the workbook or from my videos. And if you're interested, the link is in the description. I'll see you in the next video.